Hi, everyone. Welcome to the session, Why Extreme for Healthcare, Customer Spotlight. My name is Matt McNeel. I'm the Director of U.S. Healthcare Sales, and I'm proud to have Novant Health with us here today. So a little bit about Novant. Novant is a 4-state integrated network of physician clinics, outpatient centers, and acute care hospitals headquartered in North Carolina. I'm happy to have Rob Hale with Novant with me today. Rob is the Director or Senior Manager of Technical Engineering and Infrastructure at Novant. Welcome, Rob. Thank you for joining us.
Hey, Matt. Thank you for having me today. It's great to be here at Extreme Connect. Hey, everybody, please get a COVID-19 shot. It's very important.
It is important. I've got mine. I'm inoculated, and it's one step closer to getting us past the pandemic. So I totally agree. So, Rob, both of us are managers. We deal with a lot of numbers, right? In our careers, we've been doing this for 10 plus years, each of us for a long time. Heck, when I was in the 3rd grade, I once wrote 15 pages of sequential numbers to win $5. So hey, $5 was a big deal. I found out my closest other student wrote like 3. So there's a lot of information in numbers and all those kind of things. I thought you could share a few minutes about Novant's story and some of the numbers behind the network.
Sure, Matt. So let's talk a little bit about Novant by the numbers. So today, Novant Health covers 4 states. We have 17 acute care facilities ranging anywhere from 28 beds per site up to 1,200 beds per site. We have 720 clinical locations, which are our physician offices in the field. And today we're running about a total through the network about 142,000 Ethernet ports. Quite a good sized network. About 1,700 routers and switches, 43,000 phones. You see some other numbers there on some of the voice calling per month. These numbers vary pretty much every month, especially since COVID has kicked in. Our call volumes have been through the roof. We've made our conversion to SIP here on our calling, and all of that runs over the Extreme network today. You can see some of our statistics on the wireless network. Our wireless usage is going through the roof with guests coming into our facilities daily, and being able to use our wireless network has been really critical to what we've been able to put forth for Novant Health. Some of the really interesting things we're doing as well is voice over wireless. So using the Extreme network internally, we're doing a lot of iPhones over the IP network there. Some of the access points, we're getting very close to 10,000 access points total throughout our network. And again, some of the wireless components, as we continue to move further and further towards wireless and wired from our wired network, being able to support that on our wired network is absolutely critical to what we're doing today.
Yeah, Rob, these are amazing numbers. Can you share a little bit about your support staff that helps you run this network?
Yeah, I have a support staff of 36 engineers total. That's everybody in our organization. Of that, we have 14 voice technicians, and the rest are data. They're broken up into architects who design, build, work with the carriers, do the configuration builds, and then we have the engineering staff that supports all of the tier 2 and tier 3 support staff.
Yeah, and I was just looking at the numbers when we were talking earlier this week, Rob. It's almost 6 million calls. It's I did the math, and do a 12-hour day, and it's 25,000 calls an hour, Rob. I mean, that's a huge increase, obviously under COVID and some of the changes, and obviously the growth of petabytes. And I think I was looking it up, and some of the discussion point, to kind of give relevance to that 25 petabytes. Well, the whole Library of Congress is 20. You're doing this in a month. You can store with 1 petabyte 11,000 4K definition movies. So if you're a movie buff, you've got a lot of movies going on. So it's amazing to see the growth of data and applications that you're running with that. So just some big numbers there. You and your staff support. So Rob, just want to change gears here for just a second, and we're learning about the Infinite Enterprise here at Extreme, its growth, how it's growing, over the years. Obviously celebrating our 25th anniversary. We're expanding that Infinite Enterprise out. how has that helped Novant during COVID?
Well, a lot of the products that Extreme's come out with during the pandemic, before and during the pandemic, have helped us a lot. We've had to stand up a lot of mass vaccination clinics, and enablement of that agile connectivity via products and sets like the XA via cable services has helped us tremendously. I mean, we have had to stand up clinical sites in less than 2 days, and that turns out to be pretty difficult when you're trying to get dedicated connectivity to those sites. So with the XA devices, we've been able to stand them up because I have pretty good cable service in this area, working with Spectrum directly. The mass vac clinics in some of the corporations that we have locally, and in Charlotte, we opened up a huge mass vaccination clinic, seeing over 2,000 patients a day in the Spectrum Center where the Hornets play in downtown Charlotte. We have a lot of multiple events all over North and South and Virginia that allow us to do the clinical sites, both the mass vac clinics, as well as the determining sites for COVID.
Yeah, and the numbers you had to support were incredible. I think you moved from what 100, 500 vaccinations in a day to 2,200, doing 120 an hour at a time. So it's incredible the things that you guys moved to help us get through this pandemic together. So thank you. Anything else you want to highlight on this, Rob?
No, really, the enablement of the remote connectivity is one of the things that have really allowed us to do what we need to do. We stood up those remote sites. If there was any kind of connectivity at all in any of these sites, we used the Extreme enablement capacity to bring that back into our core architecture, and being able to push our electronic medical records via wireless out to those areas helped us tremendously in standing up the clinics.
Yeah, great point. I'm glad we can help you with that too, by the way. So sorry about that. So hey, I would like to talk a little bit about, you've been an early adopter and a continued adopter of Fabric, Campus Fabric and SPB solutions that was carried forward here at Extreme, and some of the benefits. I thought it'd be great also to share some of those capabilities that you've had success with as well at Novant.
Sure, Matt. So I'm just being honest, Fabric has changed our working environment entirely. We cannot have downtime at Novant Health. We are critical care. We're the in service for all the patients. So when they come into our facilities, we just cannot have downtime. It's extremely important that the patients are worked every day, all day long, and we just don't have any time for outages. We have patients and support a critical environment. When we went to the wave services at layer 2 and the enablement of Fabric technologies in our core, that increased our redundancy with the carriers. A lot of people don't know this, but when the pandemic hit, pretty much everybody was off of the road. So the North Carolina DOT, the Virginia DOT, and the South Carolina DOT decided that they would dig up everything in sight. That has happened to us and has really been a strain on our backbone architecture because of some of the outages that we've incurred due to them doing more work. We have actually reduced the amount of outages we have dramatically, and we have survived outages in our core network of over 160 gig of architecture. That is a huge amount of data to take a hit with and still survive with no impact to any service. That ensures that we can deliver critical services such as EMR and voice and video uninterrupted to the acute sites today.
Yeah, and you've been a great reference with us over the years, so thank you. I still remember you and Rich getting on a call with one of my clients in Florida several years ago, and Rich explaining having that time back, right? What I used to have to do as an architect or plan at 2 a.m. on Sunday morning, I can now do it Thursday at 4 o'clock in the afternoon and with no impact. So it's been a game changer for us both. So thank you on that partnership.
Yeah, certainly, Matt. It has really changed the way we do networking here, and has increased the ability for us to get at least a little bit of rest every now and then. So
exactly, we don't get much, but especially now under the pandemic, but it does help. So Rob, anything else you'd like to share with Extreme Connect attendees watching this?
Well, one thing is happy 25th birthday, Extreme, and the partnership with you guys has been really great so far. we're one of the things that we're engaged with you guys with is the premium support model, and engagement with the developers is critical to the service rollouts that we do at Novant Health. We're not bleeding edge, but we're right behind bleeding edge. And that premium support model engages our engineers directly with Extreme engineering. Issues are resolved much faster, and any developmental items that we bring up to the table within Extreme are considered in a much faster, reliable fashion. I highly recommend that to anybody that's out there that hasn't tried it already. It really puts you in touch with the development community, which enables us to move forward at a faster pace.
Yeah, it's nice to have a kind of a partnership as far as the service level, the account level, GTAC all the way down, Rob, and lock side by side as far as the conversations and needs together. So appreciate that.
Yeah, thank you, Matt.
Also, Rob, just want to thank you for your time here. Sharing your story with us. Novant's story is a great story of a partnership between two companies. And Rob, appreciate your time and sharing that with us today. I also want to give a shout out to all the IT and frontline healthcare workers out there. We appreciate you. You're always in our thoughts and prayers. Keep up the fight, and we look forward to get through this pandemic together. But thank you, everybody, for your attendance. Have a great day.